Hello, everyone. I am Alexandra Simonassi. I am the AmeriCorps Prevention Education Coordinator on the Colorado AmeriCorps Community Opioid Response Program. Today, I'm going to be talking to you about how to recognize and respond to an opioid overdose. So, the objectives of this discussion today is to review the scope of opioid use, what an opioid overdose is, knowing the risk factors for an opioid overdose, recognizing the signs of an opioid overdose, and knowing how to administer Narcan or naloxone, rescue breaths, call 911, and reporting a reversal. Okay, so this graph here shows the Colorado drug overdose death rates in 2002. So if you see the higher contrasted areas, that means that there is a higher rate of drug overdose rates in that county. So when I move forward onto the next slide, it's going to show a gradual increase from 2002 to 2014 in the state of Colorado, and those increased death rates happening in each county. So as you see here, over that duration of time, it's going to increase and get very dark. So from those years, 2002 to 2014, there was a 500% increase in the overdose death rate in the state of Colorado. So this graph here shows 3 different representations that are happening with different types of opioids from 1999 to 2017. So we have here in the purple, it's going to represent the rise in prescription opioid overdose deaths. So these opioids are going to be represented as commonly prescribed opioids, natural and semi-synthetic opioids, and methadone. So looking at 1999 to 2017, we see a little bit of a gradual increase happening, and then there's a small dip from around 2011 to 2016, and then it plateaus after 2016. The orange here is going to indicate the rise in heroin overdose deaths, okay? So we see pretty much a large plateau happening from 1999 to 2010. And then all of a sudden in 2010, we see a large increase happening until about 2016, and then it levels out again in 2016 and 2017, just like the commonly prescribed opioids in the purple. And then this navy color here, the rise in synthetic opioid overdose deaths, are going to be the synthetic opioids such as tramadol, fentanyl, or other prescribed medications. So we see a large plateau happening up until about 2005, and then it goes up a little bit and then back down. 2007, almost a plateau, it's a little bit of an increase, and then it dips back down. And then 2012, a little bit after, between 2012 2013, we see a little bit of an increase here, and then all of a sudden in 2013 it just starts to go up and up and up into 2017. So that's a very large increase happening. Okay, so here are some examples of opioids. These are the most commonly used opioids. Okay, so what puts people at risk for an overdose of an opioid? So we have here different circles, and they're going to represent just kind of each component that leads to the overdose. So the first one we have here is changes in tolerance or a period of abstinence. So when someone was once prior to using an opioid such as maybe tramadol, if they were up to 50 milligrams a day, and then they eventually got up to maybe 100 milligrams, so that's 2 tramadol throughout the day, and then they weaned off of it, and then they came back to that 100 milligram dosage, which was their highest dosage, this would put them at risk for an overdose because they haven't adapted to that tolerance level, okay? So the second one here is poor physical health. This simply is just kind of generally talking about how a person who maybe has organ failure or something like that, or maybe they have some sort of lung disease or lung condition where they have a lot of trouble breathing already. So when someone has an overdose, they are having trouble getting oxygen to the brain ultimately, and that's because their diaphragm has slowed down because they are so sedated from that toxicity in their bloodstream from the opioids. So therefore, their diaphragm isn't going to be perfusing that oxygen back to their lungs. So if their lungs are already having difficulty breathing, then that's just twice the amount of difficulty already. So that's simply kind of what it's indicating. So a variation in strength and content of street drugs. So when a person is utilizing street drugs, they're really not going to know what kind of drug they actually got without testing it or bringing it into a lab. So anyone could say that they, oh, well, this is heroin, but they're not going to know for sure until it's brought into a lab. And they also don't even know how much of that substances is that they actually have. So therefore, it's really hard to know what they're actually putting into their bloodstream. Okay. So mixing drugs, especially alcohol and benzos. Alcohol and benzos alone puts a person at risk for fatality or going into a coma, just an overdose in general. So to have an opioid go into their system on top of a benzo, which are both two sedating substances, that's going to put them at a higher risk for an overdose. Using alone, so I get questions on this one. So when a person is utilizing substances such as opioids alone, if they accidentally took too much and they have an overdose and they didn't tell anyone that they were using this substance, it's going to be very difficult to know how this person is doing and if they actually even had an overdose. Leading up to that event, if someone were to accidentally maybe not be paying much attention, like they were thinking, okay, well, says, 2 a day, so I'll just go ahead and take them right now because I'm in an extra amount of pain. If they weren't having that conversation with someone who isn't in pain and is able to stand on the sidelines and just take a brief overview of their medication directives, they would see that they need to break those two dosages apart and take that 50 milligram tramadol maybe in the morning and the second one at night. Okay, so this puts them at risk for an overdose. Having overdosed before. So if a person had overdosed prior to maybe today, and they're using opioids today, and they had once had an overdose 3 years ago, they went through recovery after already having had an overdose, this puts them at risk for another overdose. Okay, moving forward. Okay, so what is an opioid overdose? There's a graph here. It just kind of exemplifies what happens in the reward center of the brain, how an opioid recepts at the receptor channel in the brain. Okay, so an opioid overdose occurs when there's too much drug for the body to handle. What happens is their blood just enters this level of toxicity and their breathing rate slows down. Therefore, they are at risk for respiratory failure or arrest due to lack of oxygen to the brain. It can lead to loss of consciousness, a coma, or even death. Okay, so how do we recognize an overdose when a person is experiencing this? All right, so you might have blue lips or fingertips, or simply just discolored lips. It might be kind of like a grayish tone, purple tone. This is indication of cyanosis when they don't have enough oxygen. Okay, weak pulse, unconscious breathing slowly, loud snoring or a death rattle, also known as stridor. If they don't respond to yelling or a sternum rub, which is what I'll be showing you here further on down this facilitation, they don't respond to that, that is an indication that they're unconscious. So medical attention is required, okay? Pinpoint pupils and clammy skin. Those are all indications or signs of an overdose. Okay, so if a person suspects that someone is experiencing an overdose, these are some steps of how you respond to the situation. If someone is exhibiting
a opioid overdose, they're gonna have cold, clammy skin, pale skin, blue lips. They're gonna have pinpoint pupils, okay? All right, so how you respond to an opioid overdose, you're going to provide verbal stimuli. So, hey, are you okay? There's no sign of someone waking up. You would then use painful stimuli, so a sternum rub, which is going to be your fist like this. And then using the knuckles, you're gonna rub down on the sternum here and give a good firm rub, maybe about 3 times. This person is still not waking up, so you would need someone to call 911. Okay, so moving forward, you would provide the rescue breaths, which you can use with a barrier mask, such as this, okay, like this, or pocket mask, or even a t-shirt as a barrier. Therefore, after the breaths, if they're still not breathing, you're going to provide the Narcan, which is what I like to call the 1-1-1 rule, which is 1 nostril, 1 spray equals 1 dose. So just like this, you're going to insert into one of the nostrils here. So through this nostril, I will choose the left nostril, okay, press down, 1 spray. All right, you wait 2 to 3 minutes. If they still aren't waking up, you would provide another dosage. This dose lasts 30 to 90 minutes. And then you're going to continue on with the recovery position.
So the recovery position helps provide the person with adequate breathing. Okay, so this keeps their airway neutral and open. That way, if they are vomiting, they're not going to be on their face and vomiting at the same time, which puts them at risk to choke and die. So this is how you put a person into the recovery position. You kneel next to the person, place the arm closest to you straight out from the body, just like so. Position the far arm with the back of the hand against the near cheek, just like this. The second step is to grab and bend the person's far knee, okay? As you see here, the arrow indicating the knee, okay? Then you want to protect the head with one hand, gently roll the person towards you by pulling the far knee over into the ground, okay? Then you want to tilt the head up slightly so that the airway is open, making sure that the hand is under the cheek, just like so. Place a blanket or a coat over the person unless he or she has a heat illness or fever, and stay close until help arrives.
You would take one arm here, okay? And what you're gonna do is fold it over, okay? So you're gonna have it underneath their cheek here, okay? And then you're gonna pick up one knee and have this arm here cross over at the same time. And then you're going to roll. Okay, so you see here, his hand is underneath his cheek over here, protecting his head and providing that neutral inline position for his airway to be open. Okay, and his knee here is protecting him from rolling over as well so that he doesn't choke on his own vomit and is lying on his face. So this is how you provide the recovery position. And you maintain staying with the person. If they feel cold, you put on a blanket or a shirt to keep them warm, and you stay with them until EMS arrives.
Okay, rescue breathing. So what you need to do is tilt the head backward and open and up to open airway. Pinch the nose closed. Seal your mouth to their mouth. Give 2 slow, big breaths, exhaling into their mouth. Look to see if their chest rises. Continue to give 1 breath every 5 to 7 seconds until the person can breathe on their own. Use a t-shirt as a barrier or a barrier mask or a pocket mask, okay?
I'm going to show you how to provide rescue breathing. So what you need is a barrier mask, such as this one, okay? A pocket mask, or even a shirt to use as a barrier. So when the person is in this position, you're going to place the mask over their face, okay? And what you want to make sure of is that this white box here is actually over their lips. That's where you breathe into, okay? So that's going to be placed over their lips. You need to perform a head tilt chin lift. So with this hand, you can go on their forehead first. Take this hand, lift the chin. Once that is actually lifted, you can pinch the nose with the second hand here, pinch down. This hand's going to wrap around the seal like so, okay, run their face. This is going to help prevent air from escaping. Making sure they're in a neutral inline position, you're going to provide 1 breath every 5 to 7 seconds. In addition to that, you need to make sure that their chest is actually rising when you provide those breaths. On this count, okay? 1, 2, 3, 4, 5. And while you're providing that breath, you want to watch and make sure again that their chest is actually rising. And that's how you perform rescue breathing.
Here are some myths or don'ts for overdose response. Don't slap, punch, or forcefully try to stimulate the person. It will only cause further injury. Don't put the person into a cold bath or shower. Don't inject the person with any substance such as milk, salt water, or stimulants. The only safe and appropriate treatment is naloxone. Don't try to make the person vomit drugs that may have been swallowed. Choking or inhaling vomit into the lungs can cause a fatal injury. All right, so what is naloxone? So it's an opioid reversal drug. Okay, it knocks opioids off the opiate receptor channel in the brain. So it lasts 30 to 90 minutes. It's administered through the nose or into a muscle. Naloxone cannot reverse an overdose from any stimulant such as cocaine, meth, or alcohol. And there are no negative side effects, even if no opioids are present in the system. These pictures here are going to show the Narcan spray, the injectable Narcan, we have Zeo, and the Narcan, naloxone, okay, for intravenous injection. All right, so how does naloxone work? All right, so as briefly described prior to this slide, here is an example of an opioid that's going to bind onto this, which is the opioid receptor channel in the brain, and it fits exactly onto that receptor opening right here, okay? So Narcan is going to imitate the opioid by how it fits onto the receptor channel in the brain where the opioids enter, and it's going to fit on there exactly like the opioid does, and it's going to block off further opioids from entering that receptor channel in the brain. So therefore, it's going to reverse it, okay? Because Narcan has a stronger affinity to the opioid receptors than opioids like heroin or Percocet, so it knocks the opioids off the receptor for a short time. This allows the person to breathe again and reverses the overdose. Okay, and this is what it looks like in the box, outside of the box. You can see here the plunger is still down, therefore it hasn't been used. So it's administered like a nasal decongestant. I go with the 1-1-1 rule, which is 1 spray into the nostril, okay, which is equal to 1 dose, and you spray it 1 time, okay? So wait 2 to 5 minutes, continuing to provide rescue breathing. Administer 2nd dose after that 2 to 5 minutes if you're not seeing that person isn't waking up. Do not leave person alone and call 911. Okay, so these are some substances that they could have in their system during the opioid overdose, and this is why medical attention is required for helping this person during the opioid overdose. We're not really sure what's in their system and how much, but we can see here just how strong it is and how long it lasts, as it's exhibiting here, duration of action hours, okay? And Narcan only lasts for 30 to 90 minutes, so if something lasts 6 hours, you're gonna need more than 2 doses, okay? All right, so 911 Good Samaritan law. This is really helpful for bystanders to know about this. So it does protect the individual who is calling 911 to help this person with an opioid overdose, but only if they don't have a warrant, okay? So it's designed to reduce fatal overdoses by encouraging calls to 911. It protects the person against arrest for both the caller and the individual who is overdosing. So no arrest for small amounts of drugs or drug paraphernalia. Okay, so this is a standing order for naloxone, okay? So you can see here that back in April 2015, Colorado passed a new law, the Senate Bill 15053, expanding access to the life-saving drug naloxone, which is used to reverse overdoses to narcotic drugs, such as certain prescription medications and heroin. As a result of the new law, a physician or any medical professional with prescriptive authority can write a standing order for naloxone that can be dispensed by other designated individuals, such as pharmacists and harm reduction organizations. So with these standing orders, pharmacists and harm reduction organizations can now provide naloxone to those who might benefit from it, most including a family member, a friend, other person in position to assist a person at risk of an overdose, an employee or volunteer of a harm reduction organization, a first responder, or an individual at risk of an overdose. Okay, so how do we get naloxone? There are over 500 pharmacies across Colorado that have naloxone. It's covered by most insurance companies. There may need to have a copay paid, all right, or it's covered by Medicaid. All right, so for other examples of how to respond to an opioid overdose, there's this resource here called the Opie Rescue application. You can download and put it onto your phone. So it walks through here the different steps of how to respond to the situation. You can start a rescue, okay? And it shows here to call 911. There's a description here of what to say to dispatch so that someone is not breathing. And it tells you right here to be sure to give a clear address and a description of your location for dispatch so they know where to arrive to the person that is overdosing. How to recognize an overdose. So it walks you through the steps here and provides some indications. Okay, the body is limp, the fingernails or lips are blue or purple, etc. There's resources provided here, and to invite someone if you are scared or just really don't know if this person is actually overdosing, okay? So this is just an up-close overview of the steps of responding to the situation and providing rescue, okay? All right, so myths about overdose reversal. There have been myths out there that there is very little you can do when a person is having an opioid overdose, since he or she could die instantaneously. That is false. It is really hard to prevent someone from dying from a drug overdose since people usually use drugs in private. This is also false. Preventing death due to an overdose is not easy, and you have to have a complete, lengthy, difficult training. That is also false. Myths about overdose reversal. The person who receives Narcan will react violently when the medication is administered and his or her overdose is reversed. This is false. However, it can happen. It's very, very rare. But typically and commonly, a person who has overdosed on opioids and then has had Narcan administered to them and is waking up is going to be very out of it. They're not really going to know where they are, what's going on. They're going to feel pretty crappy. And it's going to be a little bit of a slow process getting them aware of what's going on. So that is definitely a myth about an overdose reversal. The fact that drug users can have access to Narcan will postpone their entry into drug treatment, and it will also encourage riskier drug use. Narcan is going to initiate those withdrawal symptoms after it's administered. Therefore, they have that opportunity to receive treatment and get through those withdrawal symptoms, okay? So they can move forward with recovery. Other examples of harm reduction, we have nicotine gum, seatbelts, airbags, a designated driver, safety planning, and a domestic violence situation. Having housing set up first, condoms, methadone, syringe access, or exchange programs. All right, so what is harm reduction? It is pragmatic, it respects individuality, it focuses on risk and prioritizes goals, it recognizes that drug and alcohol consumption exists on a continuum. It is tolerant and accepting. It is about empowerment and is not the opposite of quitting. So if you have any other questions, feel free to contact me at alexandra@coloradocorp.org. Thank you so much.